welcome back. We all need it, even though sometimes it's rather expensive, but there is a way to get the most out of your hard-earned dollars when it comes to health insurance. Licensed insurance agent Kelly Parton of Health Markets Insurance joins us this morning to explain. So good morning to you, Kelly.
Good morning. How are you?
I'm doing well this morning. A little fired up after eating so much spicy stuff. But we won't talk about my health. We're going to talk about some insurance this morning.
You may need a good plan.
Yeah.
Yes, you may need a good plan.
A spicy plan. So what do you or should you have in place to help cover those major medical expenses, Kelly?
To cover those major medical expenses, obviously it starts with good health insurance, and good is relative to anymore, but something that covers your pre-existing conditions. The plans out there today in Toledo, Northwest Ohio, they're doing a great job with co-pays. The max out-of-pockets are higher, but we do recommend having something on the side. You know, have a supplemental plan, have an accident plan, maybe have a hospital plan or a cancer plan, okay? Have a backup as opposed to just your health insurance.
So, Kelly, you mentioned that supplemental insurance. What is that exactly?
So let's say you have your regular health insurance. You go to the doctor, they say, hey, worst case, we found something. You have cancer. Your health insurance will pay for everything over your max out of pocket. What it does not pay for is time lost from work. And I'm not talking disability, but I'm talking about, there's big money involved sometimes when you have a serious illness. So a cancer plan, if you're diagnosed with cancer, will pay you a dollar amount wherever you signed up for upon diagnosis, and you can use that money for whatever you want, your medical bills obviously, but also your bills at home. And that's where most people run into problems, is when they get really sick. It's not the medical bills that really get them, it's the bills they can't pay at home because they're not working.
Yeah, so really important just to have that backup plan. So insurance can get a little complicated for so many.
Yes.
So who should handle our insurance for us? How should we go about that?
Well, for us, it's, give us a call. We'll sit down with you and look over your whole scenario. Now, I just want to add, there's a little change that happened a couple of weeks ago, if you don't mind me adding this. People that have been on group plans where employers are not contributing because of the cost are now able to get a subsidy for the rest of the family. It's a huge, huge opportunity for people that say, maybe they have a family of four. The husband's portion of the insurance is really cheap because the employer is paying for that, but they're not paying for the family. Well, before, the family could not get a subsidized plan. They had to go with what the employer offered, which was really hurting the budget. Now they can go get their own subsidized plan, which can save some people thousands of dollars a year.
So it's really nice that you were able to add that nugget, Kelly. So coming down and sitting down with you is really beneficial. So what does it cost to sit down with you and explore those insurance options?
Zero.
We
sit down with you. There is no cost for our services. We get paid by the company. We always do a consultation of, let's start from here, see where you're at. Here's what we're looking at. And sometimes, people do not go with what we recommend. They may go with the group side, but we want to give them the right answers. And that's what we pride ourselves in doing, is giving the right answers. You may not like the answer, but we'll give you the right answer.
So that helps in such a great way, because so many people are, financially strapped at this point too. So being able to sit down and get that advice, it helps out. So does a person have to be on Medicare to sit down to chat with you?
No, it doesn't have to be Medicare. We do under 65 insurance, so the Obamacare plans or Affordable Care Act. We help people coming off Medicaid. That's going to be a huge piece coming up because they are reassessing. Over 500,000 people in Ohio will lose Medicaid because they haven't touched it for the last few years. Now it's going to be, where do we go? So we'll sit down with anybody who has a question and try and give you the best advice.
And open enrollment is going on right now. So how long is open enrollment happening?
So December 7th is the last day for Medicare if you want to plan for next year or change your plan. Open enrollment for health insurance ends January 15th, but if you want a January 1st effective date, it must be done by December 15th. So we have a little time there. But Medicare December 7th, and then health insurance January 15th.
So we have some dates that are coming up in the next few weeks or so. So Kelly, how can people get in contact with you?
Call my number at the bottom of the screen. It's my cell phone. It's been my business phone for years. My mom calls me on it. Just give me a call on that number. If I can't get to you, my assistant will call you right back, but we'll get you scheduled as soon as possible and help you out.
Okay. Well, Kelly, thanks so much for all the great advice there.
Thanks for having me on again. Happy Thanksgiving.